Hello, my name is Eric Arrington, and I am a third-year pharmacy student at UNC, currently on rotation at the Cone Health Family Medicine Center. Today, I'll be going over the latest pharmacy news for the month of September. For this month's news, we will discuss vaccine updates for COVID and RSV. We will also discuss recent FDA approval of new indications for Ilaris and empagliflozin. First, we'll talk about the new COVID vaccine guidance. The new COVID vaccine is monovalent. The bivalent formulation should not be administered anymore. Other new guidance is about precautions with myocarditis, pericarditis, MIS-A, and MIS-CC. Patients with risk of these adverse effects should proceed cautiously with vaccination. There are two mRNA vaccines manufactured by Moderna and Pfizer. Important to note there is no more bivalent formulation. The vaccine may not be funded by the government anymore either. Pfizer indicated that it expects a commercial price per dose for its vaccine to be between $110 and $130. Moderna has also suggested the same range. Novavax is the other available vaccine. Some people may be unable to receive an mRNA vaccine as a result of an allergy to a component of an mRNA COVID-19 vaccine, or as a result of a history of severe allergic reaction, such as anaphylaxis, after a previous dose of an mRNA COVID-19 vaccine, or a lack of availability of an mRNA vaccine. This Novavax vaccine differs from others because it is only authorized for use in ages 12 and up. On this slide, we see the different patient groups and how they should be administered the mRNA vaccine based on age and vaccination history. Some groups require multiple doses, some groups require just one. On this slide, we see who should be getting the Novavax vaccine and how it is administered. An important note here, in order to reduce the risk of myocarditis and pericarditis, an 8-week interval between first and second doses is recommended. As far as administration goes, these COVID vaccines can be given at any time. Immunocompromised and older people should get them sooner rather than later, and these can be co-administered with any other vaccine. Next, we'll talk about the 2023-2024 RSV vaccine guidance from the CDC. There are two RSV vaccines. Cone chose to supply the GSK vaccine. The GSK vaccine uses the same AS01E adjuvant as Shingrix. It is covered under Medicare Part D and is $100 for Cone Health employees. Efficacy data showed a near 83% reduction in symptoms during the first season and 56% reduction in the second season. As it has the same adjuvant as Shingrix, the same Guillain-Barré syndrome adverse event is reported in some trials after vaccination. Anyone over 60 years of age is eligible to receive the vaccine. As far as who should actually get it, shared clinical decision-making should be used when making the recommendation. Whether to receive the vaccination or not is an individual decision and should be based on discussions between the patient and their healthcare provider. Decisions may be influenced by a patient's health status or their risk of severe RSV disease. Now, we will discuss the new indication approval for Ilaris for gout flares. This drug was originally approved for the treatment of periodic fever syndrome, such as familial Mediterranean fever. This is a subcutaneous injection used to treat gout flares. It has a long half-life of approximately 25 days, so frequent dosing is not needed. A clinical trial study done used the Pain Intensity Score on Visual Analog Scale, or VAS. VAS scores range from 0 to 100. The primary outcome was VAS score in most affected joint at 72 hours. The study compared Ilaris and triamcinolone acetonide, an existing steroid treatment for gout flare. As you can see here, both the Ilaris and triamcinolone treatment groups showed clinically significant change in VAS score. The mean baseline VAS score before the treatment was 74.1. The Ilaris group had a mean score of 28.1 after 72 hours, and the triamcinolone group had a mean score of 39.5 after 72 hours. This is a statistically significant difference in the groups of the average VAS score of 11.4. So, to summarize, this is the first biologic for gout flares, and the main place in therapy is for people who are not able to be treated or have inadequate response to traditional therapies like NSAIDs, colchicine, or corticosteroids. Finally, we will talk about the new FDA indication approval for empagliflozin.
The previous indication was to improve glycemic control in adults with type 2 diabetes, to reduce the risk of cardiovascular death in adult patients with type 2 diabetes and established cardiovascular disease.
Patients in this trial had an eGFR of 20 to 45 or 45 to 90 with a UACR of greater than 200. Kidney disease progression was defined as end-stage kidney disease or a sustained decline in estimated eGFR to less than 10, or renal death, or a sustained decline of greater than 40% in eGFR from randomization.
As you can see here, the Jardiance group performed better than placebo in reducing the risk of kidney disease progression or cardiovascular death, and the data was statistically significant. Here is a reminder of everything that we talked about today.
Special thanks to Dr. Pete Koval, Kaylee Mikhailochek, and Rachel Shelley for contributions to this month's updates.